Hi class, my name is Lisa Henderson and I'm going to present an overview of my internship for this course, including the project that I worked on, and share my personal leadership philosophy with you today. The organization I did my internship at was St. Joseph's Hospital Health Center located in Syracuse, New York. It is a 400-plus bed hospital that provides care throughout the central New York region and also into northern Pennsylvania. We are a magnet-recognized organization and have the only local behavioral health emergency room. St. Joseph's provides quality care compassionately to the sick and injured. It is financially and philosophically committed to providing the best possible healthcare services at a reasonable cost, even to those people who are unable to afford them. St. Joseph's accepts all patients without discrimination and supports a just culture with leadership transparency, encouraging staff to openly share their challenges and ideas. Our theme is One Heart and One Mission. My mentor's leadership qualities fit well within our organization culture. In the fast-paced, challenging healthcare environment, she remained compassionate and caring. In leadership decisions, she was well aware of financial and staffing resources, supporting good stewardship throughout the organization. She used great problem-solving skills as a team player and was flexible working with other departments. My project for this internship was a tiered huddle process for improving communication quality from frontline staff to administration. The process facilitates rapid improvement changes within the unit, escalating identified barriers in real time for immediate attention. The focus was on department metrics tied to the organization's strategic plan, and go live was November 15th. Ongoing support of this program was provided or will be provided by the leadership team and frontline champions. The objective was to engage frontline staff and improve staff understanding of the business operations, our priority strategic aims, the budget, etc. The two main focuses were situational awareness, what is happening right now and what are we anticipating, and connecting the A3 items of key metrics, PSAs, and connecting our workflow with the operational goals. So we wanted to align priority strategic aims to daily work. We wanted to enable all levels of the organization to problem solve through a systematic communication channel and feedback loop. The goal of tiered huddles was to provide an ongoing loop of communication, both from frontline staff to administration, and for administration to have a closed loop way to return communication to frontline staff. We wanted to implement continuous daily improvement by creating a culture of lean thinking problem solvers, encouraging staff, frontline staff, to become engaged and to empowered to take on decisions or challenges and make decisions for them. Finally, we wanted to create a culture of transparency with both our patients and our colleagues, connecting our business operations with our clinical operations to provide the best quality care for our patients. Each internship shadow day was a little bit different. My mentor was over 3 areas of the hospital: the emergency department, the behavioral health emergency department, and the inpatient behavioral health unit. She had a different leadership style which matched each of the different managers based on their need and what they needed supported. Each day we had meetings to review and update policy and procedure. This was to ensure evidence-based practice and clarity of the policy or procedure, ensuring that frontline staff could follow them and that they made sense. We also had meetings where we reviewed budget variances. We had to financially report out on her areas, anticipating volume, revising the budget based on actual volume versus projected volume. Specifically in the emergency department, we did a lot of work with that. She also was the lead on a substance use disorder protocol. We spent a lot of time working on that project, providing staff and provider education. We were working on the electronic medical record build, overseeing the policy development, and then putting this protocol in place and actually rolling it out to the frontline staff. Each day she also did some nurse leader rounding. This was focusing on different departments. We would go and look around and see how they were doing, stop and talk to staff to see if there were anything that they wanted to share with her. She liked to see beyond the unit and see how things were going, the flow, and any challenges that they were seeing. We would always stop by their huddle board and review their key metrics and look. Each day she had a different place that we would go to visit. The book I reviewed was The Truth About Employee Engagement by Patrick Lencioni. I believe our organization does a good job of measuring data and continues to work on open communication to identify work challenges and discuss solutions, which is a key part of the Tier Huddle project that I worked on. But there is room for improvement with relevance and anonymity. Many of the frontline staff are not able to connect their day-to-day work with the organization's strategic goals. They don't see how their work impacts the financial status. There are opportunities for recognition as well. Often they are delayed though. We could improve with real-time recognition and clearer role delineation of responsibilities. There were a few times my mentor was working on a project and we came across someone else who had either already started the work or didn't complete what they were doing, or someone who was working on it at the same time with either of the parties knowing. There's always room for improvement with employee engagement, and I think improving clear expectations and role responsibilities, as well as implementing real-time recognition, can encourage staff further to be engaged and invested into the organization. A few recommendations that I would offer someone who is going to follow my mentor is to bring a notepad with them to write notes down during the day. I would also encourage them to become familiar with emergency department and behavioral health terms and key metrics and processes so they could understand what they were discussing in the different meetings, as it was a whole new world for me. I would write down questions as you're listening into meetings and things that come up, write them down so that you can discuss them later on. And finally, I would wear walking shoes. Our emergency department is located on one end of the hospital and the behavioral inpatient unit is located on the complete opposite end. So we definitely took a lot of steps each day. In my leadership philosophy, my mission is to develop a team-based culture to provide quality, safe patient care, where nurses are engaged and actively participate in identifying and solving challenges of the unit. As a team, patient needs are met through a collaborative approach. Communication, teamwork, shared decision-making, and trust are key components to create and sustain this culture. My mission would be to be a transforming leader in the acute care setting, inspiring growth and development of personal and professional skills, as staff care and advocate for patients with compassion, competence, and kindness. In order to create the culture described in the vision and mission I shared, the following key values are needed. Excellence. I believe everything should be done to the best of one's ability, which directly contributes to safety and quality. Integrity is foundational to any organization. Being accountable for our words and actions and following all the policies and procedures demonstrates a commitment to the organization and care for one another. Justice is important. Every person deserves to be treated individually and equally. Embracing differences among us, breaking down judgmental barriers, and treating others as we would want to be treated creates a culture of trust. Stewardship. Being a good steward of time and resources is necessary to be able to provide what is needed and to offer quality, safe patient care. Each employee must value working together to efficiently use and care for equipment, supplies, and resources. Compassion is a key value. We must care for others. This is the backbone of the healthcare organization. We meet people at their most vulnerable times of life, and compassion keeps the human touch within our organization processes and care. Thank you for watching this presentation, and I hope you've enjoyed learning about my internship experience.